Those people who would not be eligible for this are those consuming calories via enteral diet, feeds, or drinks. Hyperglycemia not requiring insulin. Again, hypoglycemia and pregnancy, they have their own protocol. Insulin used for reasons other than glycemic control. Some notes. The insulin, again, we discussed this before, mixed and dispensed by pharmacy. Always, always, always regular insulin. 100 units in 100 milliliters of normal saline, which equates to 1 unit per milliliter. Must be administered via an infusion pump. Going back to the RN's responsibility, it's the initiation of therapy, and any changes in rate must be verified and co-signed by 2 RNs. And remember, for any drip, if you're the change of shift, you need to go in and verify that your drip is running at the rate in which you were given report and the rate at which it's ordered. If it is, then you go into Eclipsis, you click on it, you mark as done, and put in your notes, drip in progress, rate verified. So you acknowledge that that order is in the system. Okay? Okay, so if we look at the back sheet, which is actually the second sheet, you're going to see initial treatment. So, you're going to take a blood glucose level within 1 hour prior to the infusion. You're going to see your initial bolus dose and infusion rate is based on the first blood glucose only. And you'll see there, depending on whatever your rate is, whatever your blood glucose is, it's going to determine if you bolus the patient and what the initial rate is. Notice, you see blood glucose less than 180, they're saying don't initiate the drip. Call the MD and let them know I got a rate less than 180. Find out why they want this order. Okay, moving down below, you're going to see what you want for maintenance therapy. So I believe maintenance therapy is right underneath there, correct? So you have your blood glucose levels. They're obtained every 2 hours until 3 consecutive levels are within target range of 140 through 180, and then every 4 hours. Your adjustments in rate are based on current blood glucose level and hourly rate of change from the previous level. And then at the bottom part of that sheet, you have 2 charts. Chart number 1 is the adult ICU continuous. On that flow sheet, you're going to, depending on what your rate is, when you're talking about change, you're going to get a letter from that and then move it down to chart number 2, and that's going to tell you if you need to change the rate. If you have continuous feedings, you're going to have different parameters. Okay, so let's do an example. So looking at the back, you do your first blood glucose level at 4 p.m. and you get 350. So tell me, what would your bolus be? What's your initial bolus? 4 units. I know it's right up there in front of you, but take a look at the sheet, see how you can follow. And what would your rate be? 4 units an hour. Okay, then if you go to what the first sheet would be, flip it over. You're going to document everything, all that on. You see where it's documented on the front of the form? On the top? So where it says adult, which is actually proxy, it's in your right hand, I can see from here. So you document it on the front. Okay? When would you be drawing your next finger stick at this point? 2 hours, what time is that? 6 o'clock. Okay, 6 o'clock you get a value of 300. So going by the calculation, the way it works is you take current blood glucose divided by minus prior blood glucose to get what your rate of change is. Okay? So you're going to take 300 minus 350. And what do you get? Minus 50. You have a decrease of 50. But for what is the time period? How long was that? Right, so now you're going to divide by 2. So you get a decrease of 25 per hour. Now maybe that didn't decrease 25 per hour, but in order to work with this protocol, you need to get an hourly rate. Okay, so now go to chart number 1, and you always go vertical, then horizontal. So you see where it says increase and decrease on chart number 1? Okay, so what line of decrease are you going to go to? Negative 21 to negative 40. Everybody's following this right now? Okay. So now you've gone vertical, now go horizontal. You're gonna what is your current blood glucose? 300. So what letter? Letter E. Is everybody seeing letter E? on chart number 1. Everybody sees where you're getting letter E? Okay, so now you're going to take the letter E and you're going to go down to chart number 2. Go vertical, go horizontal. So, your first column, what's your first column? Current rate, which is? 4. Now you've gone vertical, now go horizontal to the E column. What's your new infusion rate? 4 hours. You have no change. I wanted to make a change. Is it realistic that someone's sugar is going to drop so quick? Maybe, maybe not. This exercise is more for you to be able to see how the chart works. Okay, so 4 units. Then you go back to the front. You document no change. When are you checking the next finger stick? 8 p.m., 2 hours later. Okay. Any questions? Everybody's chomping away. Okay, so let's just say you started off with 350, and now you've drawn a blood glucose at 6, and you get 52. Okay, so what do we do when it's below 70? So if you look underneath the first page, and go all the way to the bottom, you're going to see what you're going to do if your current blood glucose level is less than 70. In both situations, stop the infusion. Okay? You're going to give 25 grams of D50, which is 50 milliliters, which is 1 full amp. That's a little bit different from the regular hypoglycemia protocol with sub-Q. Usually in that case, you're giving 12.5 grams. So, excuse me. You're going to recheck the blood glucose in 15 minutes. In both of these situations, if it's less than 90, call the doctor. If it's greater than 90, you're going to repeat the finger stick again. So let's just say it's 6 o'clock, you get 52, you give your D50, and at 6:15, you get 103. Okay? What's your next step, according to this? Repeat blood glucose in 1 hour. So again, you're still not restarting that infusion. Okay? Now you repeat it, so now it's 7:15. Okay? And you get a value of 127. What are we doing? So originally we were 52, so I'm just going to flip down. If you see, depending on what the number was, in a case with 52, you'd be in the second section. You're going to go back to 4 units per hour, and you're going to go into column B. So what would you restart your rate at? Everybody see 3 units? Okay, and if your sugar was, say, 48 to begin with, follow the same process, and if you get greater than 90, then you would start with column A, you would restart at 2 units. If your repeat at that point is less than 90, call the doctor. I used to enjoy this protocol because I used to like the fact that it was nurse managed. I didn't necessarily have to pick up the phone and call the doctor for an order. And for those of you who are on the units who are not using this particular protocol, this is pretty much what the doctors are basing your orders on anyway. Okay? Anybody have any questions about this? Okay. We're getting there.
Nancy.
Sure.
But it says there, though, is there a particular form for the med-surg unit? Because
No.
It always says adult ICU.
Right. This particular is nurse managed only in the ICUs.
Okay.
If you're on the regular floors, you're following, it's going to be ordered that way, but you are not going to be allowed to titrate without written doctor's orders.
Okay.
Only in the ICU settings are they using this nurse managed flow sheet. But when you're calling a doctor, now you have an idea of basically where they're probably getting their orders from. They should be basing it on this protocol. It's just on the units, in the ICUs, they're saying that's a proper setting. On the floors, when you're 1 to 6, 1 to 8, 1 to 10, that may not be a good way to manage it because you may not have the time to run around and do it. If you have 3 patients with it, it's still very busy. Okay.